baby, Austin, wasn't eating well.
He was spitting up a lot and he was vomiting, and I just attributed it to the fact that he would be a kid that just spit up a lot.
Even around 6 months old, when doctors told Austin's mom, Erin, to start feeding him solid foods, Austin refused.
Nothing was going from finger to mouth.
Austin was getting a majority of his calories and nutrition from a bottle, but it was clear over time with the constant vomiting that continued, something was wrong.
At that point, we were sent to a pediatric allergist who tested him, diagnosed him with severe food allergies.
But food allergies weren't the only issues. Austin had a feeding disorder. Because of the vomiting, he had associated all eating with being sick. Austin needed to be retrained, and that's how they ended up here at Mount Washington Pediatric Hospital in the feeding program.
These kids either have anxiety about eating or have a history of pain with eating or have allergies that have created changes in their intestinal tract.
Dr. Richard Katz says feeding disorders can have serious consequences.
The first consequence is that these children aren't getting enough calories and they aren't growing. But the long-term side effect are that these children get unusual relationships with food and meals and lose the social aspect of eating.
11-year-old Nadia, who suffers from a rare genetic disorder, is also in the feeding program. Since changing up her diet, Nadia has been working with specialists on textures and consuming chicken.
They've provided support that has prevented Nadia from ever needing a feeding tube. Even with her level of disability, we have not had a feeding tube for Nadia.
The Feeding Day Treatment Program is a 6-week program providing intense feeding intervention where parents can observe each meal. But Mount Washington Pediatric Hospital offers a variety of services for feeding disorders to suit a child's needs.
And we take them from the very beginning where they're refusing food, try to understand what motivates them, try to give them rewards, small rewards for learning to eat. This works because it's a team effort.
Dr. Katz says it's important to tell your pediatrician if your child is not eating well and to be specific. To learn more about feeding disorders and programs at Mount Washington Pediatric Hospital, go to abc2news.com under the Health tab. For ABC2 News, I'm Ashley James.